Life365 is disrupting the healthcare industry. Joining me is CEO Kent Dicks to talk about it. Kent, thanks for joining me on Wall Street. Great to have you here on a sunny day.
Thanks, Olivia. Great to be here.
Well, talk about great. What a great concept. How did you come up with the concept of Life365?
Actually, our team's been doing digital health for probably about the last 13 to 14 years. We started with a little tiny device called an Internet of Things, which connects about 300 different devices, scales, blood pressure, pulse oximetry, to be able to connect patients remotely. This was actually probably about 10 years ago. We sold the company to a publicly traded company, a large publicly traded company, and then we left the company in 2015 and realized that healthcare was just starting to evolve, right? If you start seeing changes that are starting to occur in the marketplace today, you've seen obviously Aetna being acquired by CVS. Amazon is actually going to invest probably $500 billion into healthcare. Walmart is starting to put clinics in for labs and for doctors, and connecting rural communities now, out to patients to try to get care. So it's our mission at Life365 to actually go through and be the interoperability of connecting patients at home, right, to their doctors to try to make healthcare more efficient and reduce cost.
That all sounds excellent. How exactly does it work? What does it do?
So I'm a big believer that one solution doesn't fit all. So when we look at healthcare costs, most people probably don't know, but 5% of the population actually consumes 50% of healthcare costs. And that we're now going to a $5 trillion spend here in the next couple of years. That's 20% of our GDP. It's mainly around, the cost a lot of times is around our senior and aging population, where they have more than one chronic disease. And what we try to do is we try to take a variety of different solutions that allow people to stay in their home longer. 90% of people don't want to be in the hospital. 90% of people can't afford independent living or assisted living. So we've got to provide tools to be able to connect them to their doctors, whether it is on a smartphone, a wireless smartphone, or a tablet that allows us to interface to those 300 different medical devices like scales and blood pressure and pulse oximeter. A doctor may go through and say, Kent, I want you to take your weight once a day. I want you to take your blood pressure twice a day. I want you to take your glucose 3 times a day. We actually can do it through little tiny IoT devices, internet things, like Alexa-like devices or smartphones or tablets. We can even do it through wearables. We can do it through smart TVs to try to engage the senior population in technology, in their care, to try to keep them out of the hospital.
So how did you make it user-friendly for elderly people?
So part of that is just to make it incredibly simple. The device can actually, or the solution can be as engaging as you want. Like my mom, does use this device, but she uses tablets, and she likes to be able to do gamification, right, from that standpoint. So trying to create an app for her that allows her to take her medication, reminds her to take her medication, tells her to take her blood pressure, but does little tiny reminders and quizzes like, what 2 things don't go together? Broccoli and Coumadin, right, because of vitamin K. It gives her an engagement level that allows her to be able to go through and interact with her own care. Other people may just go through and say, I need to take my weight, no other engagement needed. Other people may just need nudges, maybe a little bit of incentive to take their medication. And you might have a certain class of people that actually wanted to be on a big screen TV. They want to get content that's related to their diabetes or their kidney care. They want to take their medication alerts. They want to be able to, I'm a big believer that when people are engaged in their own healthcare, you could actually do little tiny incentives, right, to incent them and say, listen, if you take your blood pressure and medicine on a regular basis, we'll go ahead and give you Netflix for free to be able to watch on the smart TV. And that's an economic, thing that we want to look at. If I'm spending $10 per month, right, we have to be careful of incentives. If I'm spending $10 per month, that could actually avoid a $10,000 emergency room or hospital. It's well worth it to do that, right, to try to drive care that way.
And it absolutely being so well connected, it must bring this great sense of self-awareness too for the people that need the care. Who have you teamed up with? Who have you partnered up with?
Well, we're extremely proud of our partners. One of the things that we're doing that we realize in healthcare, especially around digital health. Digital health's been around for years, but let's just say mainly over the last 10 years or so. A lot of solutions have come to market disparately, individually. Like you may have glucose solutions, or you may have blood pressure solutions or kidney solutions, but nobody's really looking at a holistic picture about looking at that person that's a diabetic, that they also have blood pressure issues, or they may have social determinant needs like food or housing issues as well. So we partnered in an integrated health platform with people like American Medical Response, AMR Ambulance, the largest ambulance company in the world. A lot of our partners are trying to solve a problem that they have in the industry today, which is, as healthcare is changing and dynamics are changing and reimbursements changing, their models have got to change too. So instead of AMR always picking up people and taking them into the emergency room and having a hospitalization, now they have fast response teams that go to the patient's home. They use our equipment to monitor them. They connect them to AMR's call center. And they use different methods through navigators to try to navigate a patient's care to reduce the amount of healthcare costs. In fact, AMR has done over 200,000 Lyft rides per year just because they're picking up people that maybe needed to go to a social service of some kind or food. They can actually triage in 911 and send a Lyft to be able to take the person to food instead of responding in ambulance and paramedics.
Excellent idea to use the resources like that. What's been your number one feedback that you've received from customers?
I think simplicity. Simplicity of actually integrating it all together and being one hand to shake. From this standpoint, we've got some major partners coming in like J&B Medical out of Detroit. J&B services a large amount of Blue Cross Blue Shields across the United States, touch 15,000 homes per day. Right, deliver to 15,000 homes, have access to over 3 million patients. We're bringing those type of partners together, because one partner is not necessarily talking to another partner. And if I can, Olivia, go through and say, I'm going to deliver to healthcare to Olivia's home, but I know all the things she may need, right, in one kind of relationship to be able to do that, whether it's a relationship with Tivity and Silver Sneakers and Nutrisystems, whether it's AMR, whether it's J&B Medical, whether it's MD Live or telemedicine that's out there as well. We want to be able to holistically bring it together so it's one offering. So, the biggest problem with the healthcare system, even a payer, is that they want to deliver these services to their members, but then they have to coordinate with 20 different vendors disparately, individually, unbundled, not holistically, and trying to put an offering out, and it just becomes very overwhelming for these large enterprise players to do it. If they can work with one place, Life365, and drive it through artificial intelligence to be able to align the best solution to the right patient at the right economics to drive the right amount of care at the right cost, that's a win for everybody.
Wow, well, Life365, a disruptor in healthcare. Thank you so much, Kent, for joining me. Congratulations on your success.
All right, thanks, Olivia. I'm glad to be here today.